Hi, I'm Dr. Carreen Pakrasi, Director of Ophthalmology in Medanta, Gurugram and Delhi. Our topic for discussion is visual impairment. Visual impairment is a wide range of diseases, starting from just normal visual blurring due to a requirement for glasses, which we usually don't include in the term visual impairment because this is correctable. It can even go to macular degeneration, where there is a complete loss of central vision. So we are going to divide this problem of visual impairment into children and adults. So in children, when they have a visual impairment, we will see signs that show that they are unable to see. So a child who is born does not normally have vision, but slowly as time goes by, they start recognizing colors, shapes, people, and start following you around. If they are not doing this, then you need to get them checked. Secondly, they may also show rapid eye movements, which is called nystagmus, which again may be due to non-development of the rods and cones in the retina, or some retinal problem which may have occurred at the time when they were born, if they were in the ICU, if they received oxygen in the ICU which was not balanced. And these again have to be seen. Some are treatable, some are not, and in the future they may cause them problems if they are not detected and treated on time. Now, other children may have simple causes of visual impairment like color blindness. So sometimes children will not be able to see different colors and they will misidentify them. This is a kind of visual impairment which is mild, which is not important. The more important causes of visual impairment are those which are permanent, like sometimes children are born with albinism, where they are unable to see because of lack of development of the pigments in the retina. You can also have another kind of problem where you have night blindness. Night blindness will usually start with children complaining that they can't see or bumping into things at night. When you get them examined, you will see that they are unable to see things very clearly, even in the center, but this progresses very slowly. So children can be born with other kinds of visual impairment causes which affect the cornea. They can affect they can have cataracts. So these are treatable conditions. However, if you have any traumatic cause, and these traumatic causes, if you don't treat them on time, then they can cause some permanent damage because the child does not know that they don't have vision, and it leads to amblyopia. So if the child has any trauma, you have to get examined to see whether they have any permanent cause of any disability. You can also get visual impairment in adults, where adults can have macular degeneration, which is a condition which affects the central part of the vision, and that vision can get progressively worse with age. There is another kind of visual impairment which is called tunnel vision. This happens in people who have glaucoma. Glaucoma, when detected early, does not leave any permanent damage, but if you detect it too late, people come with something which we call tunnel vision, where we want to avoid this from happening, because if you have tunnel vision, it means that your nerve is already damaged, and what is damaged cannot be repaired. So early detection and treatment is very important in these conditions. All these diseases will lead to varying amounts of visual discomfort or visual deterioration, which can either be handled or not handled. If they are severe and they cause the patient to have vision that is less than 20 by 200, then they can be classified as legally blind. So visual deterioration due to various conditions can sometimes be prevented and many times cannot, but by checking your eyes regularly and seeing if there is anything in the eyes that can be treated, you can prevent things from getting worse. So always get your eyes checked on time. If you have diabetes, if you have high blood pressure, if you have any family history of glaucoma, remember that these can lead to visual impairment which may be severe.